So the urethral sling is a surgery that's designed for men with mild stress urinary incontinence who have had their prostate removed surgically and who have never had radiation. And I stress that it's for mild stress incontinence because you can see how thin this material is. It does not provide enough support for moderate or severe incontinence. And what this tiny material does is it goes behind the urethra to act as a backboard for it. So if this is the head of the penis here and the urethra goes all the way back to the bladder, it's this part of the urethra where the sphincter is that needs the support when a man coughs or sneezes after a prostatectomy to help prevent it from moving. So the sling is surgically implanted behind the urethra like this in a position that helps pull it tight so that when a patient coughs or sneezes, it acts as a hammock. And so the nice part is that there's no buttons, there's no fluid. It's a very simple system. Once it's put in, it starts working right away. So it's not for everybody, but for the right patient, it can be a very nice procedure.